Research shows that certain body parts that once served a purpose may eventually disappear from the human body. From vestigial organs to structures deemed unnecessary, scientists speculate on the future of our anatomy. Join us as we explore the fascinating world of evolutionary biology and delve into the body parts that may one day vanish. Get ready to witness the marvels of nature's ongoing transformation in this captivating exploration. Wisdom teeth. Millions of wisdom teeth extractions are performed each year around the world. In fact, the procedure has come to be regarded as a sort of rite of passage for many teenagers and young adults. Since wisdom tooth removal is so common, it makes sense to ask, why do we have wisdom teeth in the first place? Wisdom teeth are one of the body parts that we don't need. Let's talk about the answer to that intriguing question and discuss why wisdom teeth extractions are necessary for most people. Most anthropologists and others in the scientific community believe that the reason for wisdom teeth relates to our ancestors' rather primitive diet. The earliest humans consumed a lot of nuts, seeds, and tough meats. Understandably, all of those raw, unprocessed foods took a heavy toll on the teeth. By the time humans reached their late teens or early 20s, their first and second set of molars may have already experienced significant wear and tear. Hence, the human body compensated by producing a third set of molars, the wisdom teeth. In modern times, the wisdom teeth have become largely regarded as being unnecessary parts of the human body. Not only are they no longer necessary, but they can also lead to a host of oral health complications, such as overcrowding and an increased risk of infection, as they attempted to erupt from the gum line. That's why dentists often recommend that the wisdom teeth be extracted during a patient's adolescence or early adulthood. Future generations might never develop wisdom teeth. For now, however, they remain an unnecessary, albeit intriguing part of human anatomy. Appendix. A large-scale review of data published in the British Journal of Surgery found that thousands of people in the UK, particularly young women, undergo unnecessary surgery each year for suspected appendicitis. A normal appendectomy is where patients undergo surgery for suspected appendicitis, but laboratory examination of the removed appendix finds it to be normal. The diagnosis of appendicitis remains challenging. As a result, overtreatment occurs in the form of normal appendectomy, which is associated with avoidable healthcare costs and postoperative complications. A blind pouch, the appendix wins no prizes for good design. It is a finger-like tube about 4 inches long that's situated on the lower right side of the abdomen. At its opening into the gut, it is very narrow and is easily blocked. This leads to an initial inflammation of the appendix. Pressure builds up within, bacterial infection sets in, the appendix swells up, and it eventually becomes gangrenous. Its bloody supply is cut off. If left untreated, it then perforates, leading to peritonitis, a spread of pus and infection throughout the abdomen and pelvis. Our ancestors, such as apes, eat a lot of vegetation, so the appendix is well developed. Humans, over a course of centuries, shifted to more meat and complex carbohydrate-based diet, and the need for an appendix was reduced. It would take a very long time, hundreds of thousands or millions of years, for the appendix to disappear, if ever. Of course, by then, human technology will have replaced us with robots or insanely more advanced biological beings. Recently, research has suggested that the appendix actually has a health benefit in storing good bacteria, so it may not be vestigial at all. Body hair. We all know that the hair on your head grows gray after some time and that age inevitably thins it out. But does the same fortune hold true for your body hair? You may be surprised to learn that hair below your neck has its own way of aging. Body hair is one of the body parts that will disappear. All body hair that sprouts during puberty, think hair on your underarms, genitals, and chest hair on guys, is controlled by hormones. Since our estrogen levels drop as we reach middle to later age, body hair growth corresponds by becoming sparser and thinner too. In fact, most people will see a significant slowdown in the production of leg and arm hair. Less body hair is the result of hormones, but there are also fewer building blocks for hair growth as we get older. Skin is thinner, there is less subcutaneous tissue, and follicles get smaller over time, resulting in finer, fuzzier textured hair. However, don't get too excited at the thought of putting down the razor and tweezers in your later years. Unfortunately, those same hormonal changes that result in less body hair often stimulate hair growth in other areas of the face, thanks to the rise in testosterone levels. If you're considering laser hair removal, keep this in mind. Since hair becomes thinner and loses pigment with age, many older people are no longer good candidates for laser hair removal, which works by chasing down pigment in your hair. So you'll want to get this particular treatment sooner rather than later. Sometimes a patient may not realize that she has as much gray hair as she does until she does laser hair removal, and those are the only hairs left behind. Paranasal sinuses. The appendix isn't the only useless body part. We have almost a dozen that have become obsolete for the same reason. Evolution has rendered them redundant. Paranasal sinuses are a group of four-paired air-filled sacs that surround the nasal cavity. The maxillary sinuses are located under the eyes, the frontal sinuses are above the eyes, the ethmoid sinuses are between the eyes, and the sphenoidal sinuses are behind the eyes. Like the appendix and the tonsils, these parts will disappear one day. Sometimes people are born without sinuses and sometimes they have them surgically removed. They present as four pairs of air-filled holes behind the nose and around the eyes. You may have felt their painful presence when you've had a bad head cold or they swell with sinusitis. They are pockets of nothing, so they make the head lighter and help the voice to resonate. Doctors agree they do little for us and more for the hosts of bacteria and viruses that decide to take up residence in these nice, warm, moist little caves, which is why they've been described as petri dishes for bugs in our head. As we continue to evolve, what else will become obsolete? We still have jaws, obviously, but they are much smaller than they were as our diet has become softer and more refined. Because our jaws are smaller, we battle to fit in all of our teeth comfortably, so wisdom teeth are potentially on the way out too. Extrinsic ear muscles. These muscles are vestigial, meaning they're remnants of evolution that once had a purpose but no longer do. However, humans may be able to repurpose these useful muscles for their own uses, according to Stephen Hackley, a psychologist at the University of Missouri and author of a new review of research on the forgotten muscles in the journal Psychophysiology. For one, these muscles activate in response to positive emotions, for reasons nobody truly understands. This odd fact creates a handy tool for psychologists seeking an objective way to measure emotion. Researchers have found that people have an elevated startle response, measured by the twitching of muscles below the eye, when they're experiencing a negative mood rather than a positive mood. This makes sense. If you think about watching a horror movie late at night and hear a sudden crash from outside, you're likely to be far more spooked than if you've been watching a romantic comedy. About a decade ago, psychologists tried to find this same response in the vestigial auricularis posterior muscle, which sits right behind the ear and attaches to the ear's base. Unexpectedly, the auricularis posterior doesn't respond more strongly when a person is in a bad mood. Instead, its response is strongest when people are at their happiest. Eventually, this body part will disappear over time. Neck rib. A cervical rib in humans is an extra rib that arises from the seventh cervical vertebrae. Their presence is a congenital abnormality located above the normal first rib. Most cases of cervical ribs are not clinically relevant and do not have symptoms. Cervical ribs are generally discovered incidentally, and often during CTs and X-ray scans. However, they vary widely in size and shape, and in rare cases they may cause problems, such as contributing to thoracic outlet syndrome, because of pressure on the nerves that may be caused by the presence of the rib. The presence of a cervical rib can cause a form of thoracic outlet syndrome due to compression of the lower trunk of the brachial plexus or subclavian artery. These structures become encroached upon by the cervical rib and scalene muscles. Many vertebrates, especially reptiles, have cervical ribs as a normal part of their anatomy rather than a pathological condition. Some sauropods had exceptionally long cervical ribs. Those were nearly 4 meters long. In birds, the cervical ribs are small and completely fused to the vertebrae. In mammals, the transverse process of the cervical vertebrae are the fused-on cervical ribs. Recent studies have also found a high percentage of cervical ribs in woolly mammoths. It is believed that the decline in mammoth numbers may have forced inbreeding within the species, which in turn had increased the number of mammoths being born with cervical ribs. Cervical ribs have been connected with leukemia in human children, so it has given scientists new evidence to believe that the mammoth's extinction was attributed to that condition. Neck ribs are redundant ribs located just above the collarbone. Only about 1 to 3% of the world's population owns this bone, and it could be left, right, or both sides. Although sometimes they only exist in incomplete form and are only as thin as a few fibers, they can still squeeze blood vessels and nerves around the neck, leading to neck and shoulder pain. Fortunately, in the future, hybrid, this neck rib is one of the body parts that will disappear one day. Palaris muscle. The palmaris longus is a muscle visible as a small tendon located between the flexor carpi radialis and the flexor carpi ulnaris, although it is not always present. It is absent in about 14% of the population. However, this number can vary in Africa, Asia, and Native American populations. The absence of the palmaris longus does not have an effect on grip strength. However, the lack of palmaris longus muscle results in decreased pinch strength in the fourth and fifth fingers. The absence of palmaris longus muscle is more prevalent in females than males. The palmaris longus muscle can be seen by touching the pads of the fourth finger and the thumb and flexing the wrist. The tendon, if present, will be visible in the midline of the anterior wrist. This long, narrow muscle runs from the elbow to the wrist and is missing in 11% of humans today. Once important for hanging and climbing, you probably would prefer to keep it if you were a martial artist or rock climber. The evolutionary interpretation of the muscle's absence is that humans inherited the muscle through common descent, and numerous animals that humans share a common ancestor with, such as orangutans, still actively employ the muscle. Close primate relatives such as chimpanzee and gorilla also do not actively employ the muscle, and hence they also demonstrate the same variability. The common descent principle suggests that at some stage our ancestors employed the muscle actively. The thumb apparatus, and particularly the thenar muscle group, then started developing in the hominin branch, and consequently the palmaris longus became vestigial. As there is no apparent evolutionary pressure concerning the muscle, it has remained largely unaffected by evolutionary processes. Erector pili muscle. What makes the hair stand up on end? Attached to the base of each hair follicle is a tiny muscle, collectively called the erector pili. When the muscle contracts, it pulls the hair upright. The muscle contracts under several circumstances. When a mammal is cold, it raises its fur for insulation, trapping a layer of warm air next to the skin. If you have a cat, you've probably seen it brush out its fur in winter. In humans, the erector pili and their function when we're cold or watching a scary movie is a vestigial trait. It serves no purpose in our own species, but is there an evolutionary remnant, for it has an adaptive function in our relatives, and did so in our ancestors. It's evidence of our evolution from fur-raising ancestors, and guess why evolution is true? Why did it evolve in ancestral mammals? They're present in all terrestrial mammals, and mammals evolved from reptiles. The fur is undoubtedly an adaptation for thermoregulation, and if you could get warmer by erecting that fur, so much the better. And early mammals were largely nocturnal, so a hair-erecting threat display may have been of little use. These small muscles allow animals to puff up their fur for insulation or to intimidate others. Humans retain this ability. Goosebumps are the indicator, but have obviously lost most of the fur. 13th rib. The lumbar rib is a very rare anomaly of the ribs characterized by an extra rib arising from the lumbar vertebrae. Extra rib rudimentary ribs, when present, usually arise from cervical vertebrae, although sacral, coccygeal, and intrathoracic ribs have also been reported. Lumbar ribs arising from vertebrae may be mistaken for kissing osteophytes, transverse process anomalies, or abdominal vessel anomalies. Adequate knowledge of this condition is therefore important for further research. Our closest cousins, chimpanzees and gorillas, have an extra set of ribs. Most of us have 12, but 8% of adults have an extra one. Although rib anomalies are most uncommon, they are reported to occur in 1% of the normal population. The lumbar rib is a rare anomaly with no reported incidents. This condition was first described by John Cumming, police surgeon, in 1926 based on radiograph findings. A lumbar rib may unite with the ventral surface of the transverse process or the tip of a short transverse process. Although usually rudimentary, it may occasionally be elongated. But lumbar ribs are less important clinically than cervical ribs and are usually mere rudiments. An extra levator costae muscle is reported associated with a lumbar rib. Of 559 skeletons in the Washington University collection, 8.8% had lumbar ribs. To date, it has not been mentioned that the lumbar rib can result in pain at a renal angle. Hence, this interesting and informative case is being reported not only for its rarity, but also for its novelty for being the first such case to be reported in India, to the best of our knowledge. Third eyelid. This is the part of the eye that you can see at the corner of the eye next to the tear duct. Although certain animals like dogs, reptiles, and fish need it for a variety of functions and protected vision, humans do not need this third eyelid for the maintenance of proper vision or survival. This doesn't mean that the third eyelid does nothing and just sits there. When we move our eyes, the third eyelid ensures proper tear drainage and sweeps debris away from the eye. For anyone who has ever walked along a windy beach, we can appreciate that particular function, right? The third eyelid is left over from what's known as nictitating membrane, which is still present in animals like chickens, lizards, and sharks. A common ancestor of birds and mammals may have had a membrane for protecting the eye and sweeping out debris. Humans retain only a tiny fold in the inner corner of the eye. A triple eyelid forms when the one main eyelid fold morphs into two or more folds. This can happen suddenly. Triple or multiple eyelid creases have various causes and are classified by certain signs and symptoms. In most cases, this extra eye fold won't go away on its own. It often requires medical or surgical treatment. A fellow-trained, board-certified oculofacial plastic surgeon may be your best option to treat this condition. There are several possible treatment options for the triple eyelids. Darwin's point. Darwin's point body part, also known as Darwin's tubercle or Darwin's bump, is a very small outer ear trait used by Darwin in an attempt to prove evolution. It is often called Darwin's point, first published by Charles Darwin in The Descent of Man as a vestigial feature. Darwin's point can also protrude towards the auditory canal, away from it, or even in multiple of these two extremes. Its presence also varies widely in the world's population. For example, in a few small studies completed, it has been confirmed to exist in only about 10.5% of the Spanish adult population, 40% of Indian adults, and 58% of Swedish school children. Much larger studies in different populations are required to make any definite conclusions regarding its presence in various populations. This body part explains that on average exists in about 10% of the human population, a rate that depends greatly on the specific size and position criteria we use to define it. Darwin's point could not be either a vestigial structure or an atavism because, although all biological traits are influenced in some way by genetics, the environment and other non-genetic factors are critically important for its existence and specific physical form. Furthermore, Darwin's point identification is problematic because it is so variable in size and location that it could be located in almost any position in the general area where Darwin defined it, even if it was barely identifiable on the ear-auricle helix. The only reason was proposed to be some kind of genetic throwback was due to the evolutionary assumption that humans evolved from some type of primate. A big problem right up front is that very few primate kinds have a decisive point on the upper part of the ear. The true fact is these are the body parts that you don't need in the future. Subclavius muscle. The subclavius is a small triangular muscle placed between the clavicle and the first rib. Along with the pectoralis major and pectoralis minor muscles, the subclavius muscle makes up the anterior axioappendicular muscles, also known as the anterior wall of the axilla. It arises in a short, thick tendon from the first rib and its cartilage at their junction, in front of the costoclavicular ligament. The fleshy fibers proceed obliquely superolateral to be inserted into the groove under the surface of the clavicle. The nerve to the subclavius or subclavian nerve innervates the muscle. This arises from the junction of the 5th and 6th cervical nerves from the upper trunk of the brachial plexus. Insertion into the coracoid process instead of clavicle or into both clavicle and coracoid process. Sternoscapular fasciculus, the upper border of the scapula. Sternoclavicularis from the mandribium to the clavicle between pectoralis major and coraclavicular fascia. Rarely the subclavius may be missing entirely. It depresses the lateral clavicle and acts to stabilize the clavicle while the shoulder moves the arm. It also raises the first rib while lowering the clavicle during breathing. The subclavius protects the underlying brachial plexus and subclavian vessels from a broken clavicle, the most frequently broken long bone. Toes. As it turns out, the future humans may have been denied the privilege of excavating fallen treasures from under their work tables easily. Scientists found that humans used to walk and balance more on the midline of their feet, but now that we have gradually transferred to balancing more towards the side of our big toe. Studies have also shown that the center of our balance is still shifting inward. This means that humans used to rely on their toes for balance, but now they don't rely on them as much. If this trend keeps going, we will no longer need our toes. One fact about the human body is that body part will be gone in the future. Due to this process, our pinky toes have dwarfed. However, as the balance further moves away from the toes, they would be simply fused. What will happen come instead depends totally upon our future lifestyle. With sea levels rising at such alarming rates, I would personally love to secure a pair of web beat for the evolutionary genie. Cockx. Humans and their ape relatives are distinguished from other groups of primates in part by their tailless, though it is unclear why apes lost their tails. Tail bones helped our ancestors with mobility and balance, but the tail shrank as humans learned to walk upright. The coccyx now serves no purpose in humans. Our ancestors who had mutations that got rid of the tail seemed to fare better, and thus our tails went away over many generations. Human infants are rarely born with a vestigial tail, though it does happen. Doctors can remove the tail through surgery without major issues. In modern medical literature, such tails lack vertebrae and typically are harmless, though some are associated with spina bifida, which means failure of the vertebrae to completely enclose the spinal cord. Tails in human infants typically are removed through surgery without complication. Although the coccyx is not entirely useless in humans based on the fact that the coccyx has attachments to various muscles, tendons, and ligaments. However, these muscles, tendons, and ligaments are also attached to many other points, to stronger structures than the coccyx. It is doubtful that the coccyx attachments are important to the well-being of humans, given the large number of coccygectomy procedures performed annually to treat coccydynia. Reviews of studies covering more than 700 coccygectomies found the operation was successful in relieving pain in 84% of cases. 12% of the time, the only major complication faced was infection due to the proximity to the anus. One notable complication of coccygectomy is an increased risk of perineal hernia. Pyramidalis muscle. The paired pyramidalis muscles are small triangular-shaped muscles that lie between the anterior surface of the rectus abdominis and the posterior surface of the rectus sheath. The defined function of the pyramidalis muscle is vague, and it is thought to tense the linea alba. The muscles are not always present or absent in roughly 20% of cases, or are often unilateral and vary greatly in size. The pyramidalis muscle is a vestigial muscle. Vestigial muscles in human beings are those muscles that are tendinous in larger parts or reduced in size compared to the homologous muscles in other species, or are frequently absent within or between populations. Pyramidalis muscle is linked to the pouch inside the metramines such as hedgehogs and the platypus, and marsupial such as the koala or kangaroo. The pyramidalis muscle has its origin in the bony pelvis, where it is attached to the pubic symphysis and pubic crest. The fibers run superiorly and medially to insert into the linea alba at the point midway between the umbilicus and pubis. It lies within the rectus sheath, anterior to the rectus abdominis muscle. The nerve supply to the muscle is from the ventral part of the nerve. Along this has been reported to be quite variable. The main arterial supply from the inferior epigastria supply and the deep circumflex iliac artery to the lesser extent. When they contract tense, the linea alba contract with the other abdominal muscles to increase positive abdominal pressure. Many authors have related the pyramidalis muscle with the erection of the penis or the assumption of upright posture in humans. Which one did you find the most awkward? Did you notice any changes in your body? Let us know in the comment below. Like always, if you enjoyed it, be sure to give us a big thumbs up and leave us some love in the comment section. To keep up to date with all of our awesome videos, be sure to hit subscribe and turn your notifications on to never miss a thing. Until next time, do take care of yourself.